Hi guys, good morning. So today I'm going to be telling you guys about ambulance. Just in case you request for an ambulance, what you should expect and what you should know about an ambulance. So we have three types of ambulance. We have the BLS ambulance, which is basic life support ambulance. And then we have the TLS ambulance, that's the advanced life support ambulance. And then we have the ICU ambulance, which is the mobile ICU. So guys, today I'm going to be listing out things you should see in a BLS ambulance and things you should see in an advanced cardiac life support ambulance, which is ATLS ambulance. Guys, journey with me. So firstly, in a BLS ambulance, you're going to see a first aid bus, which is this, and it has all the standard first aid equipment inside. So secondly, you're going to see things like your Savlon for dressing, your face masks, hand gloves, paracetamol. So you don't think the ambulance comes empty. You're going to see plaster in case you need to put up a line. You're going to see different type of face masks, and then a burnt blanket, which is this. You're going to see a surgical blade. You're going to see a tourniquet. Guys, you're going to see a sharp bus, an oxygen cylinder, which is extra. You are also going to see a trash can. You're going to see an oxygen cylinder. The oxygen cylinder should contain oxygen and is full. Okay, so this is the normal glucometer check equipment, guys. I'm going to show you guys inside what the field looks like, so that you don't, if you have diabetes or your sugar is low, this is what you use to check it. So the ambulance is not coming empty. We all know this is a stethoscope, and this is a BP machine, manual BP machine, and this is an automatic BP machine. This is for a BLS ambulance, guys. You also see different ranges of fluid, guys. You see a normal saline is drip. In locally we call it drip, but we the medical people will call it fluid. This is normal saline. This is a dextrose saline. This is a 50% dextrose. It's also a fluid, a drip, and this is how it looks like. Guys, you're going to be seeing something like this, which is a drip giving set. In this compartment, you're going to be seeing glucose, anti-ulcer patients. For ulcer patients, you're going to see this too for ulcer patients. You're going to see different types of oxygen mask. So this is a non-rebreather face mask. This also is a non-rebreather. So this is a NASA pump face mask. This is how it looks like. Oh, my face is showing. Guys, this is a different type of cannulas. So we have a pink cannula, green cannula, blue cannula, yellow cannula. There is a gray cannula too, and black, but it's not here. So you are going to be seeing different types of syringe. So we have a 10 ml syringe. We have needles. We have a 5 ml syringe. We also have a 2 ml syringe. Syringe is mainly for insulin and other drugs we can give to children. So, guys, this is a catheter, a suction catheter. We have different types of catheters. Some are actually a urine catheter, but this is for suctioning. Let me show you guys what a suction machine looks like, and we'll come back to this place. So guys, this is a suction machine. When you get that catheter, you put it here and then use it to suction fluid, could be spit, could be, provided it's liquid from the patient's mouth. That is what it's used for. So we have different types of airways were there. So this is a nasopharyngeal airway. You will see in a hospital they'll put it through the person's nose. This is a nasopharyngeal airway. It's from the nose you connect it to the patient's mouth. This is an oropharyngeal airway. This video is just for clarity's sake. You can measure it in different angles, and this one is green. This is bigger than this, so it's according to measure from the mouth to the earlobe, and then you fix it. So guys, that's for sex. So you must always see something like this in an ambulance. This is to plug things. So guys, I will come back to what you can plug here. You can plug the suction machine. You see, this is the suction machine. You can plug it here, guys. So the next thing you want to find out is bed sheets and pillow. So stretcher. This is what a stretcher looks like. This is the standard stretcher for an ambulance, and this is the pillowcase and the bed sheet. So in here you have drugs for patients. Drugs. So an ambulance does not just come empty. Nigerians should stop having the mentality that when you talk about ambulance, you're talking about dead body. No, that's not true. When you talk about ambulance, you're talking about sick and injured persons. That's what a real ambulance carries. But we have some other ambulance that heads, those ones carry dead body. But whenever you're calling an ambulance, the first thing that should be on your mind is, oh, this is an ambulance, not a head. Because a head carries dead body. An ambulance carries living person, sick, injured, and so on. It could be a mobile ICU. That means even if they tell you that you are going to an ICU hospital, it's the same thing that you see in an ICU ward that you are expected to see in a mobile ICU. It's a van, yes, but it comprises of everything you are going to see in an ICU. Guys, so this is drugs. I wouldn't want to name drugs for you because you're not a medical student, of course, but I will just bring out a compact. So that okay, so there are some other drugs, injections, and what have you. There's quite a lot of drugs you will see in an ambulance, but I wouldn't want to bug you with that. If you're not a medical student, you won't know what they look like. This is also drugs. This is how the inside looks like. You can see for yourself. So an ambulance does not come empty. The ambulance is expected to resuscitate and stabilize this patient while in motion to the hospital. That is why an ambulance is recommended to move a patient to the hospital rather than your personal cars, because your personal cars does not contain these things and cannot save this patient. Where in case this patient needs something before the person gets to the hospital, your car cannot save this patient. There are a lot of things an ambulance comprises of. This is the patch for the AED, guys. Guys, we know what this looks like. It's scissors, but we have another name for it medically. I would like you guys to find out what that name is. This is also a drug. Guys, whenever you see an ambulance, just know that an ambulance comes with solar. This is a solar panel to generate light. This solar will be able to run the light switches, the sockets. That's what it's able to run, guys. So with a spinal to actually lose the oxygen. I know you guys think that this job is quite easy. Yes, it's for an ambulance. This is a water circuit. You can there is always water inside this place, and then whenever you finish what you're doing, you wash your hand. That's what it looks like. And this is a seat. You will always have an extra bag in an ambulance. What this means is this bags contains drug, injections, and extra things that are not seen on the ambulance inside. So we call this Pampers. We all know what it is. This is cotton wool. We all know what a cotton wool feels like. And there are sizes of bandages. This is the size of bandage. This is actually used in place of bandage for special reasons. This is what it looks like when you lose it. I'll put it back. This is the size of dressing. Sorry guys, this is a gauze actually, and this is a sterile dressing. I won't want you guys to get confused. So an ambulance should always come with an extra, what is it written? Medical regulator for oxygen, O2. Should also come with a spare oxygen regulator. This is to change this, provided if that has an issue in an ambulance, we can always make changes. It should be two. So now I'm going to show you guys the real thing when you talk about BLS. This is an AED, and this is used for patients that are no longer breathing. It's either the AED tells you to start CPR. It's either you have been doing CPRO and this AED will tell you, hold on, I want to give shock. So the AED will give shock. This is a bag valve mask. You always find it in the ambulance. This is a cervical collar, guys. And there are two types of cervical collar. There is one looking like this, and there is another looking like this. This is a biohazard bag, which is a dustbin used to put blood-stained materials. This is a nebulizer. When somebody is having asthma attack, you use a nebulizer. It has a plug, everything. So you have to you have to actually get to plug it in before you can use it. So guys, now there are some things I've listed so far that you will not have in a BLS ambulance. Like this nebulizer, you have a smaller one. That's if the company chooses to have it. Then there is also something I would like to show you guys. Guys, journey with me. This time, pay close attention. So this is a multi-parameter monitor. It is used to check different types. This is only found in an ATLS ambulance. You can't find this in a BLS ambulance. So this checks your pulse. This checks your blood pressure. We're still talking about this machine, guys. This checks your ECG, electrocardiogram. That's what ECG means. So this machine does an electrocardiography activities, guys. So that's for ECG. These are the plugs. Plug it on the chest of a person. The machine also does to check your oxygen level. It will check your blood pressure, your pulse, your respiratory rate, and also your electrocardiographic activities, which is what's going on in your heart. This machine does that perfectly, guys. So for today, that will be all we'll be talking about in an ambulance. There is more, but I would like to show you when the time comes in an 8. Subscribe and make sure you like my page.